So choosing a Medicare health plan can be extremely confusing, and really understanding your need and then considering your health and your budget when choosing a Medicare health plan is very important. In this video, I'm going to be explaining to you exactly the tip that you need to understand when looking at the different health plan options that are available to you, and then understanding which direction for you is going to be best. Medicare supplement, Medicare Advantage, staying on original Medicare, not doing anything and throwing your hands up, and understanding really your options is the key way, and then really understanding your needs when it comes to your health care and where it's at, where it could be, and then the budget, allocating money towards which health plan is going to be best. Stick around, I'll be back in just a second. Hey guys, my name is Kelby Hightower of Medicare Hub. I'm the principal broker of an insurance agency that specializes in Medicare health plans. If you have not taken the time to like, subscribe, and then share our channel here on YouTube, I would encourage you guys to be able to do that. We provide content from an educational standpoint. I'm going to identify a problem and provide a solution to everything that we talk about. So there's always going to be a problem dealing with choosing and understanding Medicare. For any of you guys, we understand that Medicare is extremely confusing. We're here to make your life easy by making Medicare simple, and we're going to provide a solution out of that problem that we talk about. So always understand we're talking about a problem, we're going to provide a solution, and then give you steps of what to do next. So today I'm going to be talking about knowing your need and considering your health and budget. And one of the things that I like to talk about is covering factors like expected healthcare use, medications, preferred doctors, and budget for premiums and out-of-pocket costs. And when we're talking about original Medicare, we're always talking about Part A and Part B services. And on original Medicare, for you guys that understand this, and if you do not understand original Medicare, I would encourage you to go below in the link below and take advantage of subscribing for our free Medicare Made Simple on-demand workshop. It's provided to you with a guidebook, and it allows you to go over the complete A to Z of everything that you need to know about Medicare. And once you understand the basics of Medicare, you'll know that Medicare Part A, hospitalization, when you go to the hospital and things associated within that hospital, you have a large deductible that you're subject to. Part B, medical, everything outside of the hospital, what we call outpatient services, are going to be like doctors, specialists, and things like that, outpatient surgery, therapies, and things like that. You're going to have a small deductible, kind of a pinch of a deductible, and then you're going to have 20% of the billable rate. Now, 20% of a big question mark is an unknown number. In Part A, deductible is however many times throughout the year for every benefit cycle, which is a 60-day cycle. So if you go in the hospital, stay 3 days, come out, stay 60 days out, and then go back in, guess what? You're paying this large deductible again. Understanding your true cost allows you to understand the true risk of just being on original Medicare. So you're left with the potential of having extremely high, several thousands and thousands of dollars worth of medical costs on original Medicare, as opposed to looking at, what do I want to budget to enroll into a health plan? So for some of you guys like myself, I would rather have a little bit of a risk, like a max out-of-pocket risk, and enroll into something that's going to allow me to have great coverage, but then also realize if I have a catastrophic year, the max amount would be the max out-of-pocket. That's going to be like a Medicare Advantage plan. Now, the importance of understanding and enrolling into a Medicare Advantage plan is those are based off of networks, and they're also based off of things like your doctor getting authorization to have a surgery done. So if you just up and wake up one day and have a bad knee and you decide you want to have a surgery and you call a surgeon, that surgeon is going to remote you back to your primary care doctor. You're going to go see the primary care doctor. The primary care doctor is going to allow you to see a specialist, or you can go to a specialist, and they're going to organize the quality of care or kind of continuity of care or systematic steps and processes to get you into surgery to resolve the knee issue that you have, which may end up with an outpatient surgery being done, like a laparoscopic knee surgery. The process of that is it's done in and through the Medicare Advantage network, doctors, specialists, and hospitals. Now, if you're in rural areas, that can be a problem because the networks are very fractured. If you're in a metro populated area like we are outside of Nashville, Tennessee, there's a huge network with most of the major Medicare Advantage plans that most of our clients can enroll in that plan, understand how the plan works and the rules and regulations around that plan. And if they work within what I call that sandbox of that plan, they're playing within the sandbox of the plan, the network, the doctors, the specialists, hospitals, and things like that. We would typically enroll somebody based off of what access of doctors or doctor groups and hospital groups or hospitals that they want to be able to go to. And if they're enrolled correctly, guess what? They have a great outcome. Is there speed bumps along the way? Is there questions? Is there problems that arise with anything that you enroll into with original Medicare and a Medicare supplement or Medicare Advantage? Absolutely. But if you understand how you're going to use and access care with a Medicare Advantage plan, they're great plans to be able to enroll into, because the max out of pocket is from 0 up to the max is all you're exposed to. So if you're like me, I don't mind enrolling into a plan like that because the max amount allows me to go up to. Now, Medicare Advantage plans now, a lot of them can have national access to care. So that means you can go to another state, to another doctor, another hospital that's part of that network of that plan. So you need to be able to look at some bigger and broader things if you're going to go outside of the network. Now, for us, for my wife and I, if I was choosing to be able to get care right now, for the quality of care I'd want, I could go to Nashville, Tennessee and get the highest level of care from whether it be St. Thomas or Vanderbilt or HCA hospitals or whatever it may be, specialists when it comes to cancer or therapies and things like that. We have we're one of the mecca of healthcare, like Dallas, Texas is a mecca of healthcare. So if you're in an area where the healthcare model is huge and enormous and access to care is great, the tip is you may look at and go, you know what, it's covering factors like expected healthcare use. I want to be able to access care that's extremely well. And then also Medicare Advantage plans, if you've heard me talk before about medication, Medicare Advantage plans have drug plans built into the plans called Medicare Advantage prescription drug plans. And those plans often will have very robust, nice medication formularies, and you're going to look based on your medication, your doctors, your specialists, and care needs, and choose a plan that covers those at the lowest cost. So medication costs are often in the plans that are available here in certain markets and metro areas. Your medication costs are going to be sometimes lower than if you choose to get a standalone prescription drug plan. And then preferred doctors, and then budgets for premiums and out-of-pocket costs. You need to just be able to look at the overall need that you have, consider your health and your budget, and look at, hey, doing the 0 up to a max works for me. I'll just take this amount of money, put it aside in a savings account, and if I were to have a catastrophic year, then great, I've got it covered. If I don't, I'm going to have very low cost entry into a Medicare Advantage plan. Your costs for preventative services, your routine doctor visits, specialists, it's a few $100s a year. Most clients that are just accessing care for 5 or 10 years and not having any major catastrophic things, then they may have a major catastrophic year, and guess what? The max is still going to be lower once they pay that than the overall premium cost for enrolling into a Medicare supplement. Now, I know there's some ways to be able to go about looking at Medicare supplements, and I have a viewpoint of Medicare supplements are great plans for a lot of people to enroll into, especially when there's access to care issues, or somebody just likes to pay a higher premium, have the quality of benefit where they don't have any cost out of pocket, this risk over here that you may be subject to, or networks, you just don't want to be subject to any networks. And you want to choose original Medicare and go on a Medicare supplement, because you can go to any doctor, any hospital, anywhere, any place in the United States with original Medicare that accepts its terms and conditions, and the Medicare supplement is going to come along behind and pick up almost 100% of the cost. Most of the time, people that choose like a Plan G Medicare supplement, it's going to cover 100% of all the cost, except for the small amount of money that you will pay for the Part B deductible, which is less than $300 a year typically. So that is kind of breaking down, considering your needs. I'm going to be jumping into another insider tip that's very important on our next video. Stick around. I'll see you on the other side. And if you haven't liked, subscribed, or shared our content, go ahead and take a moment to be able to do that. And again, we have the Medicare Made Simple video that's on demand that you can watch at your own leisure, with a guidebook that's a great way for you to get educated about Medicare below. Talk to you soon.